Hi guys, how you do? I should say, happy Spinal Cord Injury Awareness Month. We are in September, and every September is Spinal Cord Injury Awareness Month. And if you're not seeing this, if you're seeing this post September, well, now you know. Every September is Spinal Cord Injury Awareness Month. So most of you know that I have spinal cord injury. I've been this way since I was 2. Um, and I have been told I should be a lawyer. I've been told I should be a doctor. And I also been recently told I should be a teacher. But I always wanted to be a singer, an actress, a director, all of it. Anything creative. But with everything I've been through in my life, I realized that I really need to be a disability advocate. So if that means law school, that means med school. Right now it means theater. So I will advocate for disability as much as possible, as much as God lets me do. And so there are not that many that I've met, at least, with a spinal cord injury and trach vent. There are trachs, but there are not vents, meaning they were once hooked up to ventilators and either got weaned off due to having surgery or just their body gaining back the strength, the ability to breathe. Most likely have surgery, or using this thing called froggy technique, which is using the muscles in the back of the mouth to breathe, or the top of the throat. But I am on a bed because my bones were stretched when I was 2, but I am not completely injured, meaning the nerves are not damaged. So the main nerve that the main nerve that makes the diaphragm contract and the diaphragm work is called a phrenic nerve, and it goes through the C1, 2, 3, and 4 in the vertebrae where the C1 nerve is, the first nerve in the cervical region, second nerve in the cervical region, third and fourth in the cervical region on the side, spinal cord. And so that is the main nerve that contracts the diaphragm. But there are other muscles in the body that also involve in breathing. The scaly muscles in your neck, the intercostal muscles in your rib cage on the side, not too far from the diaphragm, and then like 20 or 50 muscles more, because there are like 20 or 50 muscles, I can't remember, somewhere between 20 and 50 muscles in charge of respiration. And it's insane. And nobody realizes, able-bodied people don't realize it, and then doctors, they know it. But when someone like me and a few other patients that can't breathe when they spasm, they're like, why are you getting so tight? And that's what I've noticed in my 22 years on this planet. But the reason why I'm doing this now is because some things have happened to me recently in the last few days and in the last year where I didn't realize how bad this healthcare system is, how much these people don't care. And when I mean people, I mean respiratory therapists, doctors, all of it, the whole 9 yards, all of it. So I'm trying to prevent what happened to me to happen to someone else, whether in the U.S., Canada, England, China, all of it. Vet patients, this is our life, and nobody knows, nobody understands it unless we know it, and that's why I advocate strongly. People with disabilities, you need to be the authority of you. You need to know what's going on, and you need to know how to advocate for yourself. So, this is my vent. An LTV. This is my vent. I've been using this company for the last either 19 or 18 years. I can't remember. Somewhere between 18 and 19 years. Before that, when I first came home from the rehab that I was in, I had like a big, huge, obnoxious vent. You know, like the really old vents that are in hospitals. But I would always set the alarm off because I would always do more than the standard settings, and my body needs more than what the vents were programmed to do. So the company LTV and the mode that I usually on, but LTVs are the vet that I use and a vet that I recommend for all vet patients because you can because they're user friendly and they're patient friendly. But then at the same time, I learned that it's not just the LTV that we heard that this vet company by Respironics called the Trilogy is good, and I don't mind trying as long as I have my vent settings, as long as I can do A, B, and C. So last year I had a surgery, and I was in the hospital for 3 weeks. And the first 2 weeks being in the hospital was hell because the respiratory therapist put me on the hospital vent, not my vent, but which is not bad or good. It's can go either way. So they put me on their vent, but not on my settings. And I, at the time, couldn't do one of the things that vet was programmed to do. Now, a whole year later, that was God and medicine, God making my diaphragm stronger. I am stronger now, so that one mode I can now do during the day, still not at night. So they gave me this one mode, and I can do it. I can use it when I'm spasming, because I'm spasming, everything is too tight, and I get only like 10% of the air in my body. Then between 10 to 20% of the air in my body, depends on how tight my body gets. And then at night, I have sleep apnea, not like sleep apnea like I was born with it. It was more like it comes with the spinal cord injury, because there are like there's sleep apnea, and the one that I have it definitely comes with spinal cord injury, where the signal to the phrenic nerve stops. So like at night I wouldn't breathe. So all my life my vet breathed for me at night. Especially the deeper in sleep I went, I got that stuff. But they kept on putting me on a bed that every time I would sleep, I would wake up because I'm not getting air. They could have killed me because no matter how many times I kept on saying, that's not SIV, the mode that I'm usually on, or that's not the mode that I'm on, they could be like, yes it is, yes it is, yes it is. And my mom would fight, I would fight. It's a disaster. And almost the whole respiratory team at New York City Hospital did that to me. So they kept on saying, hey, Antonia, don't go to sleep apnea mode. And I kept on saying, yeah, I'm paralyzed with the spinal cord injury, doing this for God knows how long. And I've been in this hospital before. So, and they got rid of the program that they had when I was a kid. So, make a long story short, they ended up giving me my vent, or the vent company LTV. They had it, but they won't use it because they have the standard vents that almost all the hospitals use, which is so, I don't want to say stupid, but it's like, doesn't make sense where you have two different types of vents and you only give the patients one vent instead of giving the patients what they need. So the vent that they gave the respiratory therapist cannot say, yes, you're on your mode. Yes, you're on your mode, just go to sleep. So for 2 weeks, I barely slept. My mom and I barely slept because I can't breathe at night. So finally I went to the rehab part of the hospital, and there's one end, but the airways in my trachea kept on bleeding because of how dry it is, but they wouldn't put me on humidification until until I got to rehab of this theory of that hospital and this one respiratory therapist who moved from Chicago to New York. He was at Chicago Hospital, and then he moved to this New York City Hospital that I've been going to for most of my life. He got the vent. He got the proper humidification for me to sleep and breathe properly. So we need more and more respiratory therapists, doctors, nurses, everybody to listen, to go back and do their job instead of just be like, oh, I have a degree, I know my license. We are living in a world where there's kindness, sympathy, empathy, respect, nothing. And we're living in a very materialistic world where degrees count more now than ever before, which is sad. Or at least to me, it seems like we're living in a very more materialistic world. It's not solely the doctors at a hospital fault, because they're not getting paid enough, which makes them cranky. They're overworked, which also makes them cranky. But like I said, we are living in a world where I know everything and the patient and the patient's family know nothing, or at least that's the way they treat patients. So I recommend parents, caretakers, grandparents, if you have a child or a niece or a nephew. I was a kid on a vent. Listen to them and learn their mode. Learn the difference between one setting and the other setting. So, God forbid, them going to a hospital and the staff are screwing it up and taking advantage of that patient. Advocate on your child or patient's behalf. And now, doctors, if you're watching this, realistically, people breathe because because the air runs on their vocal cords and vibrates the vocal cords, and that's how people sing, and that's how people talk. If a patient wants to talk, but you are just getting the a cuff drink, that's not good. That's not good for the patient. That's taking their freedom away. And parents, grandparents, caretakers, there's more than one type of drink. There's more than one type of way to get like this. So like I have a tracheostomy and it's cuffless, meaning that the air goes in and it vibrates my vocal cords. So I can talk, and that's how I sing. The other brands, I don't mind trying as long as they're cuffless. And I understand that certain situations may need to put a cuff drink in, like going under anesthesia, so the patient can breathe properly. But leaking is not necessarily a bad thing. If it's over leaking, like if a patient is 30 with a 5.0 size, then that's over leaking or under leaking. I don't remember because that's kind of what happened. So like, as you grow, the trach size is supposed to grow with you. So right now I have 6.0, a 6.0 Shiley. But one of the saddest cases that I heard last summer is that the respiratory therapist is like, "You're so good, I know what you're doing. I work on sometime on the weekend at a rehab at a nursing home on Long Island. A young lady your age with a spinal cord injury has a cough trach and she forgot her voice." Hearing that, the possibility of my forgetting what they sound like breaks my heart. And I don't know that situation, but I pray for that situation. So, like all the time, it's just so funny. On the hospital I've been to, they're asking me, how do you talk? How do you talk? How do you talk? Why are you talking? You're gonna shake. Because they are so programmed that the first option is to put a cuff drink. Whoever fixed me up 20 years ago was smart to give me a cuff drink. I was smart to prevent SIV. Whoever fixed me up, whoever educated my mother and my father and I don't know, I was 3 years old, I got fed, but I was talking before that. I was crying before that because I couldn't breathe on that vent because my body needed more than what that vent could give me. Not every vent can do all the things that a person needs. So I'm on LTV. I heard trilogies are really good. There's another type of vent that's a suctional coffin. There's a nebulizer in one. I don't mind trying that as long as I can talk and I can read. But we need staff members to listen. We need patients to advocate for themselves. We need patients to learn and know what's wrong. What not necessarily wrong. Just because you're on a train and you're paralyzed, that doesn't mean load a phone. That doesn't mean that something is wrong with you. And so I have to go now. But thank you, you too, and I hope this helps. Bye.